What do you say to those students to help them figure out if this is actually the career path for physical therapy being that career that they would want to go into? So what would you tell to students that maybe, they're just not sure, is this what they want? Or they kind of just think, what, this is like a decent career path. And this is what I chose as a freshman. And that's why I'm just sticking through it. And sometimes that's why you see students who have lack of motivation and aren't doing as well. What do you say to those students to help them figure out if this is actually the career path for physical therapy being that career that they would want to go into?
I think it's two things. The first one is more obvious, and that's just expose yourself to it. Because I think there's a lot of people that just don't expose themselves to the profession they want, whether that's, being a physician, being a physical therapist, whatever it is. That's the first one that's more obvious. The second one is more internal, and that's more so just figuring out what you want. Like detach physical therapy, detach being a physician, detach whatever you're aiming for, and just write down. Like, I love journaling, so just grab a piece of paper and just write down, like, what does a successful career for me look like? What is it like? Is it something where I want to help a lot of people? Is it something where I want to work with people? Maybe I don't want to work with people. Maybe you just want to, like, work on a computer and that's it. So, like, what does it look like? And then ask yourself, does it match what I'm aiming for? Because I think sometimes we feel like we have to have this crazy, amazing story. Oh, I got injured. And then somehow, no, like we don't all have that, but this is the career that you're going to be attached to, and you can do different things once you get there, right? Like we're doing, right? But I think those are two things. Like, just expose yourself to it, and then ask yourself, find out for yourself. Don't try to impress anybody else. Don't try to impress your parents or your family members. Ask yourself, what do I want in a career? What does it need to do for me? And what do I need to be able to do for others or my family or whatever? And if it doesn't match, then maybe it's not it. Just because you heard it from a friend, just because you saw it on, top 10 professions in America that will be, whatever. So
100%.
That's my answer.
Yeah, just to add to this, because I was actually a pre-pharmacy student before I switched over to pre-physical therapy. And I think two things: don't chase after something just for dollar signs, because that's kind of what I did. For that's pharmacy, sure. I was kind of in between both. Just to be honest, I was like, pharmacy or PT. I got into this internship, this summer internship. It was super competitive. So I was like, oh, I guess this is a sign. Go to pharmacy. It pays a little bit more at the beginning. I guess I'll choose that. Come to find out, wasn't the right path. I switched back over. So that's one. And two, don't glorify physical therapy or being in medicine or being in dentistry. Don't glorify any of that. I don't care what you see on YouTube, day of the life in this. They are not telling you everything. I don't care what TikTok you see. They are not telling you everything. You see 15 seconds of how great it is to be a med student. You do not see the other 23 hours or whatever it is to be a physical therapist in medicine, a surgeon, or whatever. So those are the two things I would say.
I think that's awesome advice. And to piggyback on that, can you share a little bit of your experience working as a physical therapist or getting into the field, and kind of how you got into it?
How I chose physical therapy?
Physical therapy and like your experience in the field.
Oh, yeah. So to keep it short, the main two reasons I chose physical therapy is patient satisfaction, which a lot of people in medicine choose. Then the career opportunities are, in my opinion, just endless. You can do a lot with one degree in physical therapy, whether it's clinical, treating everything from the head to the toe, all the age ranges in between, to non-clinical stuff like what we're doing or creating an app. You can be as creative as you want with this one degree. Then in the physical therapy field, I work in an outpatient clinic. Sometimes I do skilled nursing facilities as well. But that's pretty much where I'm at right now. I treat mostly orthopedic injuries. Sometimes I see a little bit of neurology in there. I have about 3 or 4 neuro patients right now, but it's mostly orthopedics between 45 and 70. I get some young patients, some athletes sprinkled in here and there, but it's a fun time. It's great. I love the patient population. It's like going to a barbershop every day for work, or a hair salon.
That's awesome.
It's great. It's great. That's what I'm doing now. And in short, that's a little snippet of why I chose it and what I'm doing.
Yeah, I think for me, in short, because we're trying to keep everything short, right? There's always a
No,
long
I know you
story.
can go. Yeah, for sure, you can go on
So
for hours about it.
yeah, I mean, so for me, it was I found physical therapy by accident. I was always told by my parents that there were three options and three options only. I was born in Kenya, so for me, it was lawyer, physician, or engineer. Those were the big three.
Mm.
I've ironically heard from other students that were born in other countries and they were told the same things by their parents.
Those are the.
But at my high school, my junior year, they did, they invited alumnus, once a year. And basically, these were different professionals that would go into a classroom. You would get to pick two of them that you were interested in. You would sit in there, see if you really wanted, ask your question, and that was it. So the two that I saw that were out of the three that I was given options for were the physician and the lawyer. One of them happened to be full. So I was like, okay, I can't do that. So I signed up for the other. I can't quite remember which one. And so I did the next best thing that any high schooler would do. I picked the list that had most of my friends in it. And it happened.
There you go.
Therapist. I didn't know what a PT was. I had no idea. I had friends growing up that were like, I'm going to physical therapy after injuries, but I didn't know what they meant. I was just like, cool, you do you. So basically, I went into the classroom, and instead of talking to my friends, this lady who was a physical therapist started to explain what she did. And she had all these cool gadgets, and all I could think at that moment, and this was my spark, was I was like, wait, she gets paid to do that? So for me, my definition of a job switched, because I had always thought, oh, I got to do all this crazy stuff. And she was showing me these things that looked like more play than work. Right. And so that was it. But from there, I just started researching it, talking to other PTs, shadowing them, and I fell in love with it. That's how I got in. For right now, I graduated 3 years ago as a physical therapist. I came down to Florida, became a clinic director here for about a year and a half. But then I stepped away about a year ago to be more PRN. And so now I'm home a little bit more. We have a baby that's going to be born a week from today.
Oh, wow. Congratulations.
Appreciate it. So right now I am, kind of balancing the two, but still loving what Casey said was on point. It's just loving the opportunities. With PT, you can pretty much decide, hey, I want to go work with neuro patients, or I want to go work in the hospital now, or I want to go work with outpatient. And so I've been an outpatient ortho PT since starting working with athletes. But it's just cool to know that there's options. And so I love the profession.